Hellman, the Acting Library Director at the Plymouth Public Library. We're here today to talk about the Recovery Corner we have at the library and community partnerships. The goal of the Recovery Corner was to have low barrier access to materials on substance use disorder and recovery, as well as harm reduction materials. Information that we have back there includes information on treatment centers, treatment options, and harm reduction centers, as well as peer recovery centers. We have Narcan and fentanyl testing strips, and it's located on the first floor in the back of our new book room. Today we're going to be mainly focusing on the community partnerships that we have to keep the Recovery Corner going. So we'll get started with some introductions.
Hi, I'm Gerald Randall. I'm Director of High Point Hub and Spoke. I'm also CEO and founder of Hardcore Connections. My mission is to provide education and meaningful connections to help improve substance use and mental health issues in our community.
Hi, my name is Rodney Brown. I'm the Assistant Director of the Plymouth Recovery Center, downtown Plymouth. We are a peer support center who offer a lot of different groups throughout the day. We are open from 9 a.m. to 8 p.m. Monday through Friday, 9 a.m. and 2 p.m. on Saturday. And all are welcome. Just come on in and get your recovery on.
My name is Michael Kelly. I'm the Program Manager for Plymouth COPE. We are under the BAMSI umbrella. We are a health program, harm reduction drop-in center located in Plymouth.
My name is Keegan Callahan. I'm the Community Outreach Liaison for South Shore Recovery Center, also located in Plymouth, which is an outpatient facility located in Plymouth, Mass. We provide clinical and medical treatment for mental health and substance use disorders.
So one of the things we're going to focus on today is community partnerships and how we've worked with all of these organizations to have programs and materials provided for our Recovery Corner. So I thought we would get started on ways that each of you have partnered with the library so far.
Well, I'll take the lead with that. I think for us as healthcare providers and people that are embedded in the community, it seemed like an obvious spot for us to be would be the library. We're talking about a nexus of information. You know, historically, libraries would be the nexus of the community, the books, the education, the community. We've always had a good connection with the library, and we've always been super impressed with the staff and the openness of the needs of the community. And I feel that the Recovery Corner that they set up was just another outreach spot or another place that folks can get information and supplies, because not everybody has transportation, not everybody has the time and the ability to go from one place to another. So in connection with the library is how these different agencies work together in the community, and we're able to sort of like have a cohesive outline to help folks.
Yeah, I'd agree, Mike. I think I'm more hitting the nail on the head. It's like low barrier, low threshold access to some of these, most importantly is the education piece, Someone teetering on the fence, maybe not willing to commit to a level of treatment yet, can still go into a safe space like the library and find information, find resources, and with harm reduction being a key focus of that, right? Find low barrier access to some of these supplies, right? To keep people that may be engaging in risky behaviors as safe as possible, while looking for a spot to get connected to improve, quality of life.
The library is also open to hosting community events, so we've also been able to create gatherings, if you would, you know what I mean? We did an event that all the providers at this table were part of, which was called We Remember, We Recover. And what we were able to do was to bridge Overdose Awareness Month into Recovery Month, and have an array of services there at the event, and food and community, artwork, bouncy houses, and a whole bunch of stuff at the library, as well as Rodney mentioned about having space for community groups and 12-step groups and recovery groups. The libraries open their doors to us hosting events to bring folks in and sort of have a safe space for folks to learn and support each other.
Do you all want to talk a little bit more about the overdose awareness, the We Remember, We Recover event we did? Because that was really strongly in conjunction with one another, from planning meetings to execution of the program. I know that was kind of initiated by you all, but all of us were at those planning meetings, so.
Yeah, I think that was a great opportunity to show how hip the library is, and supportive to the recovery community, and give a spot for all treatment providers that are in the area, to rub elbows with each other, right? Hear and learn some of the great things that you guys are doing over there, learn about the recovery corner, and more importantly, be able to know who to reach out to provide these meaningful connections. So it really helped to bring in a unity in the community, where I feel like historically treatment providers are kind of siloed doing their own thing. It kind of got everyone in the same basket, so to speak, right? To say we're all here to support the same mission, right? Which is people challenged with substance use, challenged with mental health issues, provide education to anything that may be beneficial to an individual. I think that the traction that was gained from that event was just phenomenal. Like Mike said, it was a great segue from overdose awareness into Recovery Month. To try to keep a positive spin on that, but also not take away from the lives lost. I think it was a unique venue, with a phenomenal turnout. And just a low threshold place for it, So super grateful for Maureen, and the library and their willingness to support, those of us in recovery, those of us trying to find recovery, or maybe even just learn a little bit about it.
For me, I feel like this event was a bridge for the community to come together. You know what I mean? Like Maureen set that corner up, and I think that right there gave a platform for the whole community to come together. To have get more information on recovery and not have to because of the stigma, right? We all know there's a stigma out there around addiction and recovery. So for them to go to a safe, quiet place at the library, to have a corner where they can go to and get some information, to figure out which direction they want to go in, I think that's key.
Yeah, kind of like what Jerry said. I remember coming by. I was pretty new to the Plymouth recovery scene when I came down here, and Maureen was. I remember somebody directed me to the library. It might have been Mike. And I said, really, the library, really? And I remember bringing my coworker by, and he said, this isn't your parents' library, and just the amount of support, the fact that there was a recovery corner in a library, was just phenomenal to me, and the amount of support and involvement you had, and you guys had with the recovery community is impressive.
Another thing that came out of that event for the library and the recovery corner in particular was we saw a huge uptick in the numbers of Narcan that was taken from the recovery corner and testing strips and other harm reduction materials we had. So I think it was a way not just for all the providers in the library to connect, but to really connect to the community, to the fact that this resource was there. So that was another positive library-specific thing that came out of that event. Another thing that we offer at the library is use of our meeting spaces, which we've been able to do a number of times with these organizations. So Michael, Jerry, I know you both have either things in the works or have done things in the spaces before. I don't know if you want to talk a little bit more about that.
Yeah, absolutely. I think something I want to let people know is how open and available the library was when we were processing the opioid settlement funds in Plymouth. We were able to have community meetings there where we had people from the town and providers, we had community members, we had people that were engaging in active use there, and it was a safe place again to have people's voices be heard. As a result of that, it added to the transparency of that process, with that. And I know we're talking about some things like opioid settlement funds and Narcan and fentanyl test strips. These are all under the umbrella of harm reduction. And harm reduction is a health model that is working to meet people where they're at and to engage with folks that may not have the same experiences with other outlets, whether that's a health provider or a common public space, and to get non-judgmental care and information and support. So basically, the library has been open for our community to connect with the Plymouth community and make it one community, which it really is. Yeah. I thought it was also a great opportunity when we did the We Recover to bring new providers in. We just met Keegan and some of the folks that came down and opened up, and we sort of jumped him in, if so to speak, by putting him and his agency, who are helping a lot of people in, and like, this is how we do it in Plymouth. These are the places, these are the folks we want you to connect with. And again, the library was the center for a lot of those experiences.
100%.
I want to speak to a positive about someone accessing Narcan, I think, while we're talking about it. So I engaged with this individual. I was waiting in line at Dunkin' Donuts for my coffee and saw this guy. Something was up. Had a brief conversation. I let him know where I work. I let him know what I'm here to do. I also let him know other places where he can access some of this stuff, like over at Peacope, over at the library. And this is when I was still facilitating the MARA meetings over there at the library. Excuse me, thank you for letting us get and rocking there, with Medicated Assisted Recovery Anonymous. And so I'm walking in there with my bag of stuff to go kick off the meeting, and I saw that same individual walking in there and walking back to the recovery corner. And I was like, that was just like a eureka moment, right? Saying like, all right, so this dude wasn't willing to engage with someone that works in treatment, right? But still wanted to learn more about it and still very quickly learn that there was access that can make his using experience safer and get him at the library. That was super cool to me. Yeah.
So for those of you at home that wondering what Narcan is a medication that can reverse an opioid overdose. It's freely available, and it is a life-saving tool that we try to get into not only people's hands that may be the person overdosing, but the people around them. The people in the community have it. Everybody's going to be a little bit safer. And it's usually the people that are hanging out with somebody that overdosed are there to help somebody quicker than a first responder.
And just to touch on that too, we also have Narcan available at our smaller branch down in Manomet. And it was really important to me to find out from our branch librarian down there that a much older gentleman had come in and his wife was on a pain management program, and he wanted to take some Narcan home because they had run into an issue of her taking her medication more than once, and it was just there as a safety precaution. So it really does expand farther out than just the people who are using and the people who are with them while they're using. It's applicable and useful for people of all walks of life.
Everybody has a right to safety, and to be okay,
Another thing I wanted to talk about was some new initiatives that are taking place in library spaces. Jerry, I know you're working on planning an event.
Yeah, so coordinating with Cats at the Table, and some of the resources that we had at our We Remember We Recover event, at the library, just as the Hardcore Connections event, simply for the fact of it's an ever-changing landscape of the recovery community, right? So there's new services like Keegan coming into the cut, we got to be aware of anyone else coming in that we need to jump in, right? So to speak, so we know who is who, right? Who to reach out to for what, right? Try to bridge any gaps in communication, and just give clear expectations to individuals that work in the field, or maybe trying to access people that work in the service, sector of it. How to do it, right? And to show that the library is a safe space, right? Where you come and learn about this stuff, and make some meaningful connections, hopefully.
And that's important in a town like Plymouth, where we have a seasonal population that's here in the summer. It's a very big town, it's a very big county, and we don't want to lose people, we don't want to lose people through the cracks, so to speak. So one hand knowing what the other is doing is vital when we're trying to help people on their journey, and just, whether they want to be in recovery or not, just to stay alive and have dignified services provided.
People coming with their families, kids, right? That wouldn't happen, or hasn't happened historically, right? For some of these other events that happen at a treatment centers or that treatment driven, So it was really cool to see, people that may or may not, have someone involved with substance use or, misuse, to come and check it out. And see what is accessible there, right? And I love Maureen said, what's more punk than a library, because they do so much more. Keegan said it too, it's not your parents' library, right? It's more than just books, the stuff that they can do there is phenomenal. The support that they have for and of the community, I think, is phenomenal, right? And that needs to be put on blast.
Talking about families coming in, one of the things that we added to the Recovery Corner after we had initially got it going, we have children's books that deal with grief life, and also kids who may be struggling with parents or loved ones who are using. So those are great resources. There's also one section that's dedicated to teens and parents, just getting general information on substance use and how to talk to your kids, and materials that are more specific for teens and how they can go about dealing with any issues that they're having in that moment. So that's another cool thing we were able to add with community partners.
That's awesome.
Rodney, I know that we had been talking about doing a recovery dance. Do you want to tell us a little bit more about that?
Yes, so I came up with the idea of recovery dance, recovery gala, whatever, because a lot of people in recovery don't know how to have fun without drinking or doing drugs. Myself as well, I kind of like struggled with that. So I came up with the idea, let's just do a recovery gala, like a fancy type of thing, right? Where people can dress up and feel good about themselves and come to a place and celebrate, their successes or whatever, looking nice, feeling good without having to drink or drug. And we plan to do that at the library with Maureen's help.
Yep, one thing we already got started with that was the library did a semi-formal clothing and accessory drive. We had such an incredible turnout with that. So many donations came in, shoes, clothes, jewelry. We were able to get that into the hands of 2 different community partners, actually. So that's been really great. The Recovery Corner is possible not only with their support and the town's support, but also the support of the community. They are really getting behind having these services there and materials there, and that makes it even more effective and just a better resource for the community.
Something that's been very supported as well is not just the population that we're working with, but as providers, we all have lived experience, and the library has always been very open to all pathways of recovery. Everybody at this table has lived experience that we can pass on to the community, to each other, and help people along their journey. And the library has been super supportive with the recovering community in Plymouth, which is very big and very healthy recovering community.
Absolutely.
So on that note, I think we're gonna wrap it up. I want to thank all of you for coming here today and talking about what you do and how we work together to get more resources into the community. If anyone has any additional questions about the Recovery Corner or would like to contact any of the providers here, you can reach out to the library at 508-830-4250 or visit our website at plymouthpubliclibrary.org.